I got a guest in this segment, and they're the latest sponsor of this War Zone podcast presented by the Gateway Pundit. It's the Diabetes Reversal Group. 37 million Americans have diabetes, but a stunning 98 million have pre-diabetes. But I have fantastic news. Diabetes Reversal Group has the only patented system in the world that reverses type 2 diabetes. This is what's amazing. And then I'll go right to our guest. Diabetes Reversal Group, DRG, guarantees results after following the program if your A1C is in 5.9 or lower while taking no diabetic meds. You get a 100% refund plus $1,000 just for trying. You have nothing to lose by trying it. Wow. I mean, that's the guarantee of all time. I've never heard anything like that in my life. Dr. Kristine Burke is the Chief Medical Officer for Diabetes Reversal Group. And you can register for a free seminar at reversemydiabetesfast.com. Reversemydiabetesfast.com. Dr. Kristine Burke, welcome to the Wayne Allen Root Show. How are you?
Thank you so much for having me.
Great to have you on. So you are a triple board certified medical physician, 32 years of experience, published author, associate professor of preventative medicine at Loma Linda School of Medicine, chief medical officer for Diabetes Reversal Group, otherwise known as DRG. How could you afford to make a guarantee like that? I've never heard anything like that in my entire life, and the only thing I could think is every single person that tries this thing must meet with success, because nobody would be crazy enough to offer money back plus $1,000. Nobody wants to give anyone back $1,000. I'm in business. Nobody wants to do that. I'm betting you never do it because everyone must meet with success. Am I on the right track here?
You are absolutely on the right track. It's true. When people follow the protocol, after 15 years of experience and fine-tuning, we know exactly what needs to happen to reverse this disease. And so if people follow the protocol, they see success.
And how do you define reversing type 2 diabetes? That statement, reversing type 2 diabetes. How do you define that?
So type 2 diabetes is reversed when somebody has, like you said in the intro, a hemoglobin A1C of 5.9 or less, and they're taking no diabetic medications to achieve that number. So we're not using medications to try to manipulate or shift the blood sugar numbers. We no longer need those medications, and now the person's metabolism is just working the way that it's supposed to.
What are some common complications of type 2 diabetes? If I'm not mistaken, I don't have it, thank God, and I'm not pre-diabetic, thank God, but I do know people who have diabetes, and it's a killer disease. I mean, if it doesn't kill you, you could lose your toes, you could lose your leg, you could lose your feet, you could wind up with a myriad of diseases. Tell us what diabetes leads to.
You're absolutely right. The complications of type 2 diabetes can be really devastating. So, we start with blurred vision that can lead to diabetic retinopathy. That is actually the leading cause of blindness in adults aged 20 to 74. The diabetes or the high blood sugar damages those tiny blood vessels in the retina, and that leads to what's thought of as irreversible damage. But I'll tell you, I have had patients who have done this program where we have seen improvement in their retinopathy, so that's amazing. Next up, we have kidney disease, and this one is huge. Diabetes is the #1 cause of kidney failure in the United States, and that leads to needing dialysis, and it leads to needing kidney transplants. And right now, there are about 90,000 Americans on the kidney transplant list. We also have heart disease. Diabetics are 2 to 4 times more likely to develop heart disease or to have strokes. That same blood sugar damage that we see damaging the blood vessels in the retina leads to chronic inflammation, plaque formation in the vessels, and heart disease ends up being the leading cause of death for most diabetics. It takes about almost 70% of them. We also see erectile dysfunction in men. The same damage happening to the blood vessels leads to that erectile dysfunction, and it occurs in about 75% of men who are diabetic, and it happens about 10 to 15 years earlier in the diabetic group than in the non-diabetic group. And then you mentioned neuropathy in the feet, which can lead to pain and numbness. That loss of sensation means that we can develop infections that can lead to needing the amputation. And there are almost 73,000 amputations that are performed every year in this country, and the majority of those are needed because of diabetes. Then we have things like the brain, where there's twice as much risk of developing Alzheimer's disease in diabetics. And some researchers are even calling diabetes type 3 Alzheimer's disease because that risk is so high. And then lastly, we have cancer. Diabetics are 50% more likely to develop cancer because the same environment that creates inflammation and causes all of those other problems is also an environment that encourages cancer to grow. So a lot of complications, devastating.
You know what? Dr. Kristine Burke, I knew all of those except for cancer. I had no idea that diabetes made you much more likely to get cancer too. I knew every one of the others, but I had never heard that. That's really a stunning list. I know we have a video. Let's play a testimonial video for someone who successfully completed your program. Damon, please play the video.
Been a diabetic at least 12 or 13 years. I was injecting myself with basal insulin, Levemir, at between 20 and 40 units a day. I was taking 500 milligrams of metformin twice a day. Approximately 4 months later, I was off all of my medication, off of the basal insulin, off of the metformin. My blood sugar numbers had dropped. They have consistently stayed right around the 100 level. My A1C measurement of blood sugar when I started was around 7.5 or 7.6. When it was last measured, it was at 5.6, which is no longer diabetic. And so it's been able to be reversed under the program.
All right, Dr. Kristine Burke, what's the latest craze with Ozempic and all the other drugs like it? I don't know all the names, but I think there's like 10 of them that are just offshoots of Ozempic, and people are reporting tremendous weight loss. But are there side effects, and what could they be doing to themselves for the rest of their lives by getting on these drugs?
That's such a great question because there's no doubt that these medications can have short-term benefits. We see significant weight loss. We can see significant improvements in the blood sugar numbers, but the side effects and consequences are quite serious. We know that patients with diabetes are already at risk for something called gastroparesis, where the stomach stops contracting so it doesn't empty properly. And we see a significant increase in that in GLP-1 agonist medication users like Ozempic, like you mentioned. We see more commonly, we see severe nausea, we can see vomiting, and then in serious cases, we can even see pancreatitis, which is potentially fatal. So that's the one side of the issue. The other side is that these are forever medications. You can't stop taking them because you not only lose the benefits that we just listed out, but you also you damage your metabolism and your blood sugar regulation doesn't work properly anymore. And so you either are stuck taking the medication forever, so it's a forever medication at a very expensive price point, $1,000, $1,500, sometimes $2,000 a month. And the insurance is inconsistent. Sometimes it covers, sometimes it doesn't. So it's really just a Band-Aid approach, and it doesn't do anything to address the underlying issues in the metabolism, which we can correct.
You guarantee results, as I said when we started this interview, and I've never had anybody that guaranteed results like this. Everyone says your money back if it doesn't work. Nobody ever says your money back plus $1,000. How does the guarantee work?
So the guarantee works because the program works. And I'd love to tell you a little bit about how the program works, because then it'll make more sense why we feel so confident about being able to guarantee it. May I?
I just want to let you know, Kristine, we're running into the time clock here. We got like 1 minute left. So you got to be quick. You got to give me 30 seconds on how the program works.
Okay. The program works because food isn't just nutrition, it's information. So we have exact eating protocols that help to restore the insulin sensitivity. We use specific supplements that are clinically researched to help improve the blood sugar and the inflammation. We have an exercise program that's safe for diabetics, over 240 delicious recipes, because food has to be amazing or we won't keep doing the right things. And the most important thing that the program offers is support. There's group support, there's one-on-one support with our health coaches, and that is one of the big differences that makes it so successful. And because of that, we can offer that money back guarantee.
All right, register to attend a free seminar at ReverseMyDiabetesFast.com. ReverseMyDiabetesFast.com. Dr. Kristine Burke, thanks for all you do at ReverseMyDiabetesFast.com.